Knock, knock. Hi, my name is Emily. I'm going to be your nurse today. Can you tell me your name and date of birth? All right, so Mr. Stanton, we are going to go ahead and do an assessment on you. I'm going to then talk about kind of what we are here for, what we're going to do for you, and how we're going to get you better and get you back out of here, okay? So I want to check his IV site, make sure it's patent, it's not infiltrated, it's not red or tender. I want to check that the tubing is not kinked, it's not shoved up underneath of him, it's running correctly. He does not have a catheter, so I would check to make sure the tubing is not kinked. It's hooked to an immovable part of the bed. It is filtrating. I would look at the urine, making sure that it was not cloudy or there was no sediment in it. If it did, I would then go ahead and empty the bag and let the healthcare provider know. I want to also make sure that it is not all clogged up as well. I want to check that his room is well lit. He has an easy pathway to the bathroom. There is no obstacles in his way. Also making sure that his tubing is changed when it was needing to be. Check the IV and make sure that it is labeled with the correct medication that it has. Alright, so I'm going to go ahead and do an assessment. I'm going to feel your arms, look at your legs, do some lung sounds, and listen to your stomach. If you have any questions, go ahead and ask those questions whenever, and I will answer those if you have any, okay? So I'm going to go ahead and lean over you and look at your neck. We're just checking for some jugular vein distension, and that just occurs when you have too much fluid, okay? I'm going to look at your arms. They are a little pale, but they are warm, and they are dry. There is no edema in your arms. I'm going to go ahead and take a look at your fingers. I'm just checking your cap refill, making sure it's less than 3 seconds. You're getting your circulation where it needs to be. Okay, I'm going to have you push down on my arms and push up on my arms. All right, awesome. I'm going to go ahead and take a look at your lung sounds. I'm going to listen to 8 on the front and 10 on the back. Go ahead and sit up for me. Alright. I'm going to go ahead and look at your stomach. It is flat. It's not distended. Are you having any pain in your stomach? No? Okay. Are you passing any gas? Or when was your last bowel movement? Alright. Are you having any pain when urinating? No? Alright. So I'm going to go ahead and take a listen to your stomach. I'm just listening for some bowel sounds. Okay, you do have bowel sounds times 4. I'm going to go ahead and palpate your stomach. I'm going to feel for any obstructions, any hard spots in your stomach, which you didn't have any. I'm going to go ahead and feel your legs. It does look like you do have some pitting edema in your legs, and that's about a +2. I'm going to feel your toes for your cap refill. You do have some pedal pulses present. I'm going to have you push down and pull up on my hands. Are you having any pain anywhere other than, or any in your legs, arms, stomach, anything like that? Okay. So you came in with some nausea, vomiting, itching, and you were pretty tired. Your lung sound sounded pretty decent. There was a little bit of wheezing in there, not much, but that would also explain some of your shortness of breath. Okay, so the crackles and the wheezings that I did hear, we want to go ahead and keep an eye on that. So I will be in more frequently to check that and make sure it's not getting any worse. Okay, and we're going to keep an eye on your level of consciousness because you did come in pretty tired, and we want to make sure that it's just getting better and it's not getting any worse. So the doctor's going to go ahead and do some lab tests. We could do a BUN, a creatinine, a CBC, some ABGs, which are arterial blood gases, and we're also going to look at your electrolytes. And all this does is basically takes a look and see how your kidneys are working, okay? And you do get dialysis Monday, Wednesday, and Friday. Did you go ahead and go yesterday on Wednesday, or did you not go? Okay, you didn't go, so that would explain kind of why you're not feeling good. Your vital signs came back to 101 for your temperature. Your heart rate was 102. Your respirations were 24, and your blood pressure was 153/97. And your O2 stats, just bottom line, it's about 90%. So we're going to go ahead and give you some supplemental oxygen to bring that O2 stat up to at least 92%. And we want to make sure that you're not getting anything lower than 92% on your O2 stat, because that could cause some issues. Okay. Your lab tests are showing a BUN of 62. Your creatinine was 3.9. Your potassium was 6.3. And your pH was 7.32. So your BUN and creatinine show some kidney failure. You also had hypokalemia, hyperkalemia, and hypernatremia. So you had a low calcium, a high potassium, and a low sodium. Okay, and that 7.32 pH, that just means that you're in acidosis, because it's at you're not at the norm of where it needs to be of 7.35. Okay. So the reason that you're feeling pretty sick is because you did skip your dialysis, and it's causing a buildup of toxins in your blood, and also that high potassium can also cause you to feel not out of your normal. Okay. So we're gonna go ahead and get you signed up for some hemodialysis this morning, hopefully in the next hour or so. And then when you get back, I'm going to go ahead and come back in, and we're going to talk about the different things they found during your hemodialysis, and then we'll give you some medications if they order some medications for you, okay? So stuff that we want to make sure to consider before you go. I'm going to hold any hypertensives that you have. Hold any medications that are going to be dialyzed out of your system, and we're gonna I'm gonna assess your vital signs, lung sounds, and heart sounds right before you get to go, okay? And then when you get back, we'll do some other stuff for you, okay? So I'm gonna go ahead, put your stuff in the system, and hopefully they come get you, and then I will see you right before they get you, okay? Alright, knock knock. Hi, I'm Emily. I'm still gonna come back and do your vital signs, your lung sounds, and heart sounds, and then they're gonna be coming to get you. We are gonna hold any of your medications that you have ordered for you this morning, okay? Because they can be dialyzed out of the system. And then when you get back, we'll go ahead and give any medications that they ordered and talk about what they found, okay? So I'm just gonna go ahead and do a full set of vitals on you, and then I'm gonna listen to your heart and your lungs. Go ahead and sit up for me. Alright. So you do still have some of those crackles in your lungs, but your heart sounds sound normal. Your vital signs are fine. Your only thing is your O2 stat's pretty low still. It's still at that 90% range. Okay, so I'm going to let them take you. I'll be back and to see you as soon as you get back with some information about what they found, okay? Alright, knock knock. Hi, I'm Emily. I'm still your nurse, okay? Can you tell me your name and date of birth? Alright, so what they found with your dialysis this morning is they took 3 liters of fluid off, So the doctor is going to go ahead and order you some Poetin, erythropoietin. Basically what it is, it forms red blood cells and it helps with your anemia. Okay, so some side effects that you could have would be an increased blood pressure, some swelling, some nausea, some dizziness, and then we're also going to give it sub-Q. So I'm going to go ahead and give that to you in your stomach. And it can give you some pain at the site, okay, because we are giving you 2,000 units, okay. So I'm going to go ahead and take another set of vitals on you because I want to double check your vital signs since you came back. I'm going to do some heart sounds. We'll go ahead and do a weight, and then I will double check in the orders that we don't have any labs that we need to draw, but if we did, we would go ahead and do that at this time. Okay, so I'm going to go ahead and grab some of my equipment that I'm going to need to give your medication, and then I will be right back to go ahead and do that medication, all right? All right, so I'm going to go ahead and have your medication. I double checked in the MAR that this is what you needed. I looked on the medication bottle to double check that this is the erythropoietin. Can you tell me your name, date of birth? And do you have any allergies? No? Alright, so I'm going to go ahead, check your wristband, double check the wristband with the MAR, double check the MAR with the doctor's order, and check the correct medication that I grabbed out, that it is the correct dosage and exactly what I want. And it is. Everything matches correctly, no errors. I'm going to need gloves, alcohol prep pad, my medication, and my syringe. I'm going to go ahead and put my gloves on. I would need more than one alcohol prep pad because I'm going to need to clean the top of the medication. And I'm also going to need the site and one for afterwards. I want to make sure that I'm giving this sub-Q. I don't want to give massage the site after giving it. Making sure to give it a 45-degree angle. If they are smaller, if they're more bigger, I would give it at a 90-degree angle to make sure I get it in the subcutaneous. So I'm going to open my pad. I'm going to clean the site of my medication syringe. I'm going to go ahead and take draw up my amount of units. And still, and draw up. I want to make sure there is no bubbles. In my medication. Okay. I'm going to take my alcohol prep pad, clean the site. I'm going to take a pinch and jab in at a 45-degree angle. Give the medication slowly. Okay, once the medication is, I'll draw it back. If it would be blood, I would go ahead, put a cotton ball or a sterile 4x4 on it and put firm pressure on it. I would take that off and I would put a Band-Aid on. I would take this and discard it in the Sharps container. I would then go and take my gloves off, wash my hands, and I would make sure to answer any questions. I'm going to make sure to check back with him in about 15 to 20 minutes to make sure, and no later than 30 minutes, to make sure he's not having any adverse reactions. I want to, again, remind you that it can cause some high blood pressure, some swelling, some nausea, some dizziness, and some pain at that site. So if you do have any side effects, go ahead and put your call light on and let me know, okay? But I will be back in to give you some discharge teaching when the doctor has given me the paperwork. But just kind of heads up, some things that we're going to talk about is making sure that you're going to dialysis, because if you don't, again, you'll be back in here feeling the same way. Making sure to check your nutrition status, making sure that you're taking in the correct foods and not anything that you shouldn't be taking in. Call the healthcare provider if you're getting any signs and symptoms that you've never had before, or you've had them before and you're kind of not sure about them. And then, again, if there is any signs and symptoms out of the normal, make sure you call as well. So I'm going to let you hang out here for a little bit. When I get the discharge papers, I'll go ahead and bring them in for you, and then we'll get you on your way. Okay, thank you.